This is the Neighborhood Center's Airborne Infectious Disease Exposure Prevention Plan, effective on September 1st, 2021. Exposure controls during a designated outbreak. Now, minimum controls during an outbreak. During an airborne infectious disease outbreak, the following minimum controls will be used in all areas of the worksite. Number 1, general awareness. Individuals may not be aware that they have the infectious disease and can spread it to others. Employees should remember to maintain physical distancing, exercise coughing and sneezing etiquette, wear face coverings, gloves, and personal protective equipment as appropriate. Individuals must limit what they touch, stop social etiquette behaviors such as hugging and handshaking, and wash hands properly and often. Stay-at-home policy. If an employee develops symptoms of the infectious disease, the employee should not be in the workplace. The employee should inform HR and follow New York State Department of Health and Centers for Disease Control and Prevention guidance regarding obtaining medical care and isolating. Health screening. Employees will be screened for symptoms of the infectious disease at the beginning of their shift. Screening questions and attestation sheets will be placed at each building and are to be completed by each employee when they first arrive. Employees are to self-monitor throughout their shift and report any new or emerging signs or symptoms of the infectious disease to HR. An employee showing signs or symptoms of the infectious disease should be removed from the workplace and should contact a healthcare professional for instructions. The health screening elements will follow guidance from New York State Department of Health and CDC guidance if available. Face coverings. To protect your coworkers, employee will wear face coverings throughout the workday to the greatest extent possible. Face coverings and physical distancing should be used together whenever possible. The face covering must cover the nose and mouth and fit snugly but comfortably against the face. The face covering itself must not create a hazard, for example, have features that could get caught in machinery or cause severe fogging of eyewear. The face coverings must be kept clean and sanitary and changed when soiled, contaminated, or damaged. Physical distancing. Physical distancing will be followed as much as feasible, avoiding unnecessary gatherings and maintaining a distance of at least 6 feet or as recommended by Department of Health and CDC for the infectious agent from each other. Use a face covering when physical distance cannot be maintained. Hand hygiene. To prevent the spread of infection, employees should wash hands with soap and water for at least 20 seconds or use a hand sanitizer with at least 60% alcohol to clean hands before and after touching your eyes, nose, or mouth, touching your mask, entering and leaving a public place, and touching an item or surface that may be frequently touched by other people, such as door handles, tables, gas pumps, shopping carts, or electronic cashier registers and screens. Now, because hand sanitizers are less effective on soiled hands, wash hands rather than using hand sanitizer when your hands are soiled. Now, we'll cover cleaning and disinfection in the next section. In section 3, respiratory etiquette. Because infectious diseases can be spread by droplets expelled from the nose and mouth, employees should exercise appropriate respiratory etiquette by covering the nose and mouth when sneezing, coughing, or yawning. Special accommodations for individuals with added risk factors. Some employees, due to age, underlying health condition, or other factors, may be at an increased risk of severe illness if infected. Please inform your supervisor or HR if you fall within this group and need an accommodation. Now, Advanced controls. For activities where minimum controls alone will not provide sufficient protection for employees, additional controls from the following hierarchy may be necessary. The agency will determine if the following are necessary. Elimination. The neighborhood center will consider the temporary suspension or elimination of risky activities where adequate controls cannot provide sufficient protection for employees. Engineering controls. The neighborhood center has addressed appropriate controls to contain and or remove the infectious agent and prevent the agent from being spread or isolate the worker from the infectious agent. Now, subject to changes based on operations and circumstances surrounding the infectious disease, engineering controls that are anticipated to be used are listed in the following table. General ventilation in all buildings will be altered if possible to increase the percentage of fresh air. High efficiency air filters have been installed in buildings. Cleanable barriers such as partitions and or clear plastic sneeze and cough guards will be installed where necessary. Automatic disinfection systems like our Zono machine have been acquired and are in use in the child care area. Now, administrative controls are policies and work rules used to prevent exposure. Subject again to changes based on operations and circumstances surrounding the infectious disease, the following specific administrative controls are anticipated to be used. Increasing the distance between workers, identifying and prioritizing job functions that are essential for continuous operations, limiting the use of shared workstations, and posting of signs reminding employees of respiratory etiquette, masks, and hand washing. Personal protective equipment are like eye protection, face shields, and gloves that protect the wearer from infection. PPE will be provided and used and maintained in a sanitary and reliable condition at no cost to the employee. The PPE provided to an employee will be based on a hazard assessment for the workplace. Face coverings for all employees in all buildings and programs. Optionally, face shields and child care, as well as full body coverings and shoe coverings in child care if required by the state agency.